Okay, so this is my IV insertion video. So first I'd come in. Hi, my name is Tessa. I'll be your student nurse today. Can you please verify your name and date of birth? Perfect, Mr. Smith. So I would go ahead and tell him why I am here. So I tell him that I am here for getting his IV inserted and ready to go. I could simply just ask him if he's had an IV before. Mr. Smith said he has not. So, Mr. Smith, I'm just going to tell you that you will feel a little poke, but it shouldn't be too bad or too painful. So some things I want to look at before I would insert an IV is his overall skin and his arm. I see that he has healthy skin. It's intact. There's no type of injury. He had no previous surgery. I checked his fluid status and he is very well hydrated, so I don't have to worry about dehydration and having his veins be small or fragile. So I saw that Mr. Smith is going to be here for a few days, so I'm going to avoid his hand area and I'm going to put it up in his forearm. So first I would go ahead and get my supplies all ready. I would already have them in the room and I would be hand sanitizing my hands. So what I'm going to have is a sterile IV starter kit, my J-loop for my extension, my needle, and then a sodium chloride syringe as well to prime my tubing. So I'm going to go ahead and open my tubing. And so I don't have to do it after I insert the IV. I'm going to go ahead and prime it right away. So since this is still sterile, I can go ahead and attach this and just prime it to make sure stuff goes through and set this to the side. I'm going to go ahead and get my needle ready. So this is a 22 gauge. Needle size all depends on the person's weight and swelling, edema, where you're putting it. So I chose 22 for him. I'm just going to open it and also drop it down. I can go ahead and open my IV starter kit. Okay, so it's been used before, so in the hospital setting it would not be. The first thing I would take out is going to be my tourniquet and just put that to the side. I have my ChloraPrep in here, which I'm going to use for 30 seconds on whatever site I choose for a vein. I'm also going to have my StatLock and my Tegaderm for after I put the IV in. So I'm going to go ahead and hand sanitize. And we're going to put my tourniquet on. So since I'm looking at his IV right here, I'm going to go ahead and put the tourniquet right above it. And you just want to make sure that it's not too tight, that you can get at least one finger underneath, which I can. And then I'm going to go ahead and sanitize again, and we're going to put my gloves on. So I'm going to go ahead and pick my IV, and I'm going to go with this one right here. So I'm going to go ahead and disinfect it for 30 seconds. And I'm going to start in the middle and circular out. and you want to use that friction. All right, so go ahead and set that aside, and that's only for a one-time use. And we can go ahead and let this dry. So I already have 2 pieces of tape down here that I'm going to use to stabilize my IV after I insert it. And now that that's dry, I'm going to go ahead and get my needle ready. So I'm going to go ahead and take off the cap. I'm going to put my index finger on the hub to make sure I can move it into the vein, and my bevel is going to be pointing down. So I'm going to go ahead and press with my left hand thumb down on the vein to stabilize it. Okay. So I'm going to go in at an angle and then straighten it out as soon as I see the blood return. And I'm going to push that in, put my finger down, get my perfect. So I'm going to go ahead and keep my thumb there to keep it in place, and I'm going to draw black for a blood return, which I have. And I'm just going to do 2 mLs into the vein just to flush it out, and everything is running through smoothly. Now since I have blood in here, I can just put the whole thing in there. It's not going to hurt the patient. Perfect. So I'm going to take my tape and my tourniquet off. I'm going to go ahead and stabilize the site. And there's a lot of different ways that you can stabilize this. I'm going to get to go ahead and take this off since I have blood return. Clamp it. And use my other piece of tape and just put this up here as well. Now, in a different setting, I would go ahead and use my stat lock, which would go right over the top, and I would just peel the sides back, and it stabilizes this really well so the patient can't pull it out or it can't be moved. And then the Tegaderm would just go right over it to protect that. And then I would go ahead and just document everything and make sure that my patient was stable.